What are the key components of a professional behavior consultant's ethical code, and how should a consultant ensure compliance with these standards in practice? Answer: a professional behavior consultant must adhere to ethical standards outlined by the American Veterinary Society of Animal Behavior (AFSAB) and other relevant professional organizations. Key components include integrity and transparency, always providing honest assessments of a situation with no misrepresentation of skills or outcomes; confidentiality, maintaining client and patient privacy in all consultations and records; competence, only offering services for issues that fall within the consultant's area of expertise and ensuring referrals when needed; avoiding conflicts of interest. Consultants must disclose any potential conflicts of interest to clients and work impartially. To ensure compliance, consultants should engage in regular ethical training, document all client interactions thoroughly, and participate in peer reviews or audits to ensure they are meeting professional standards. Describe the legal requirements for maintaining behavior reports in a clinical setting and explain how to ensure that these records remain accurate and comprehensive. Answer: in clinical settings, behavior reports must comply with various legal and ethical guidelines, including the Health Insurance Portability and Accountability Act (HIPAA), which governs confidentiality of client information. Behavior consultants must ensure accuracy. Documentation should reflect precise observations, the methodology used for behavior assessments, and the specific interventions recommended. Be thorough. All aspects of the consultation, including initial assessment, recommendations, and follow-up, should be documented. This can be crucial in litigation or when cases are referred to other professionals. Retention of records. According to state and federal laws, behavior reports must be retained for a minimum of 5, 7 years, or as prescribed by the state board after the last client contact. The records should be stored securely, either electronically or physically, to prevent unauthorized access. Clear and objective language. Consultants should avoid subjective terms and focus on measurable data. How can an animal behavior consultant build effective partnerships with veterinary professionals, and when should a consultant recognize the need for referral? Answer: building effective partnerships with veterinary professionals involves establishing open communication, mutual respect, and shared goals for animal welfare. Key strategies include regular communication, sharing information about the animal's progress and any concerns that arise during behavior consultations; understanding the veterinary role, respecting the veterinarian's medical expertise, particularly in cases where medical conditions may be affecting behavior; joint action plans, collaborating to create integrated treatment plans that address both medical and behavioral components. A consultant should refer a case when medical concerns. If a behavior issue is potentially due to an underlying medical problem that requires a veterinarian's intervention. Beyond expertise. If the behavior problem falls outside the consultant's scope of knowledge, such as in cases requiring complex behavioral pharmacology or severe aggression. Jane is an experienced animal behavior consultant who has been practicing for over 10 years. She is noticing new developments in behavior science, such as advancements in behavioral pharmacology and animal cognition. How should Jane approach her professional development to stay current in the field, and what ethical considerations should she keep in mind when incorporating new techniques into her practice? Answer: Jane should take several proactive steps in her professional development. Continuing education. Participate in workshops, online courses, and conferences to stay updated on the latest research and techniques. This is important for maintaining certifications and adhering to professional development requirements set by organizations like the International Association of Animal Behavior Consultants (IALC) or AVSAB. Ethical considerations. When incorporating new techniques into her practice, Jane must ensure that the methods are backed by sound scientific evidence and are applied in the best interest of the animal. She should also consider client consent, informing clients of new techniques and ensuring their understanding and agreement before implementing them. Competence, ensuring she is fully trained in the new methodologies before applying them in her consultations. Evidence-based approaches, balancing anecdotal evidence with scientific rigor when adopting new strategies. How can an animal behavior consultant effectively interpret and apply scientific studies in their practice, and what statistical methods should be understood to critically evaluate research? Answer: interpreting and applying scientific studies involves a few key strategies. Critical reading. Consultants should not only read the study but also critically assess its methodology, sample size, and relevance to their practice. Understanding statistical methods. Consultants should be familiar with basic statistical concepts such as p-values, indicating the likelihood that results are due to chance. A p-value less than 0.5 generally suggests statistical significance. Confidence intervals, indicating the range within which the true result is likely to fall. Effect size, a measure of the magnitude of the treatment effect, which is more meaningful than significance alone. Translating research into practice. The consultant should consider the real-world application of the study's findings, particularly whether the research applies to the specific animals they are working with. What challenges might arise when trying to translate research findings into actionable behavioral interventions, and how can an animal behavior consultant balance scientific rigor with practical experience? Answer: challenges in translating research findings include generalizability. Research often uses controlled conditions that may not replicate real-world scenarios, making it difficult to directly apply to individual cases. Limited scope. Some studies may only address specific behaviors or species, which might not apply to all the consultant's cases. To balance scientific rigor with practical experience, anecdotal evidence. While research should guide decisions, a consultant can incorporate personal experience and professional judgment when applying interventions, particularly for complex or unique cases. Trial and error. The consultant should carefully monitor the animal's progress with each intervention and adjust based on what works best, always being prepared to revise the approach based on outcome data. What steps should an animal behavior consultant follow when designing a behavioral research project, and what ethical considerations must be addressed before conducting the research? Answer: when designing a behavioral research project, the animal behavior consultant should follow several key steps. Formulate a hypothesis. Clearly define the research question and hypothesis, ensuring it's measurable and researchable. Plan methodology. Select the appropriate research design, such as observational studies, experiments, or surveys. Choose reliable tools for data collection, such as behavior checklists or standardized observation protocols. Sample selection. Define the population or sample from which data will be gathered, ensuring diversity to prevent bias. Ethical considerations. Before starting, obtain ethical approval if required, particularly when involving animals in research. The Institutional Animal Care and Use Committee (IACUC) may be needed. Informed consent. Obtain consent from all participants, owners, and animals, explaining potential risks and the research process. What is the process for publishing and disseminating findings in the animal behavior community, and what steps should be taken to ensure research is accessible and impactful? Answer: to publish findings, an animal behavior consultant should select the right journal, choose a peer-reviewed journal specializing in animal behavior, veterinary science, or psychology. Ensure it matches the scope and focus of the research. Manuscript preparation. Prepare the manuscript according to the journal's guidelines, including a structured abstract methodology, results, and discussion. Peer review. Submit the manuscript for peer review. Reviewers evaluate the study's validity, reliability, and relevance to the field. Incorporating their feedback strengthens the publication. Dissemination. After publication, present the research at professional conferences or seminars. This outreach ensures broader exposure and discussion. Open access. Publish in open access journals to ensure free access to the research, enhancing its impact. This allows others in the animal behavior community to apply findings to their practices. The consultant should actively engage with professional networks to promote findings, using platforms like webinars, conferences, and professional newsletters for wider distribution. How should an animal behavior consultant handle cases that require behavioral intervention beyond their expertise, and what role does collaboration with other professionals play in such situations? Answer: when a behavior consultant encounters a case that exceeds their expertise, they should referral to experts. Recognize when a case requires specialized knowledge, such as complex behavioral disorders or psychiatric conditions, and refer the client to a veterinary behaviorist or a certified specialist. Consultation. In some cases, collaboration with experts can help fine-tune the behavior intervention plan. Joint efforts ensure comprehensive care, especially in situations where medical or psychological conditions are suspected to affect behavior. Documentation. Clearly document all referrals and consultations. Ensure that all involved professionals are informed about the case details to ensure continuity of care. Collaboration helps provide the best possible outcome for the animal, combining expertise across fields. It also ensures that the behavior consultant remains ethical by not overstepping their professional boundaries, as outlined by the AVSAB ethical guidelines. The consultant's role is to ensure the animal's well-being and find the most qualified professional for complex situations. What legal requirements must an animal behavior consultant adhere to when documenting behavior reports, and how does this influence the consultant's practice? Answer: legal requirements for documenting behavior reports include confidentiality. Under HIPAA and state-specific regulations, the consultant must maintain confidentiality regarding client information. All personal and health-related details must be stored securely. Retention of records. Documentation must be retained for a specified duration, typically 5-7 years, depending on state regulations. Accurate and detailed records must include the behavior assessment, treatment plan, and progress notes. Accuracy. Consultants must ensure that reports are objective, clear, and comprehensive. This includes documenting both positive and negative outcomes and any modifications to treatment plans. Legal liability. Proper documentation can protect the consultant in case of legal disputes. Well-documented reports provide a record of professional conduct and decision-making, which is crucial if litigation arises. Informed consent. The consultant should ensure that the client has signed consent forms acknowledging their understanding of the treatment process, any potential risks, and the consultant's responsibilities. Explain the process of differential reinforcement of alternative behavior (DROP) as a treatment strategy for canine separation anxiety. Why is timing critical in implementing this technique? Answer: differential reinforcement of alternative behavior (DROP) is a technique used to address undesirable behaviors by reinforcing alternative, more appropriate actions. In the case of separation anxiety in dogs, the goal is to teach the dog to engage in calm behaviors rather than anxiety-driven actions like excessive barking or destructive behavior when left alone. For example, the dog can be trained to stay on a mat calmly when left alone, and this behavior is reinforced with treats or praise. The alternative behavior is gradually strengthened while unwanted behaviors are ignored. Timing is critical because the reinforcement must be immediate to establish a clear connection between the calm behavior and the reward. Delays in reinforcement can confuse the dog and inadvertently reinforce anxiety-related behaviors, worsening the problem. Consistency and immediate reinforcement are essential to reshape the dog's response to separations. The American Veterinary Society of Animal Behavior (AVSAB) emphasizes using gradual desensitization alongside counter-conditioning and DRA to modify behavior effectively. What are the primary considerations when addressing feather plucking in captive parrots, and how can environmental enrichment help mitigate this issue? Answer: feather plucking in parrots can be caused by several factors, including stress, boredom, medical issues, or environmental inadequacies. To address this issue, the first step is to rule out medical causes such as nutritional deficiencies, infections, or hormonal imbalances through a veterinary assessment. If medical issues are eliminated, behavioral factors can be considered. Environmental enrichment is essential in managing feather plucking. Parrots require complex stimuli to prevent boredom and reduce stress. Providing a variety of toys, especially foraging toys, social interaction, and enriched habitats such as swings, perches, and safe areas to explore is crucial. Encouraging natural behaviors like foraging, vocalization, and social interaction with other birds or humans can significantly improve the parrot's mental well-being. Social enrichment (e.g., time outside the cage with supervision and sensory stimulation (e.g., varied textures, sounds, and visuals) are essential to creating a stimulating environment. The Association of Avian Veterinarians of recommends a multifaceted approach that addresses medical, environmental, and behavioral needs to reduce stress and prevent feather plucking. MS Lopez has a dog and a newly adopted cat. The dog displays intense interest in chasing the cat, and the cat hides constantly, showing signs of stress, excessive grooming, dilated pupils. What steps should MS Lopez take to manage this situation? Answer: MS Lopez should address the situation by focusing on managing the environment, desensitizing both animals, and providing enrichment. Environmental management. To reduce stress, MS Lopez should create separate spaces for the dog and the cat, ensuring the cat has places to retreat to, such as high perches or hidden spaces. This will allow the cat to feel safer and more in control of its environment. Gradual desensitization. MS Lopez should gradually expose the dog to the cat in controlled, non-threatening ways. For example, starting with visual exposure while keeping a safe distance and rewarding calm behavior in the dog. Slowly decreasing the distance over time while monitoring the cat's comfort levels is crucial. Behavioral modification. The dog should be trained to focus on alternative behaviors such as sitting calmly or looking at MS Lopez when the cat is present. This can be reinforced with positive rewards. Enrichment for both animals. The cat should have access to stimulating toys and activities that reduce stress, while the dog should be provided with mental stimulation and training to redirect focus. Resource guarding can escalate to aggression. How would you modify this behavior using counter-conditioning and desensitization techniques? Answer. Resource guarding is a common canine behavior where dogs exhibit protective behaviors over valued items, such as food or toys. The goal of counter-conditioning and desensitization is to change the dog's emotional response to the presence of people or other animals near its resources. Desensitization. Gradually introduce low-level triggers, e.g., approaching the dog while it's eating from a distance and increase the intensity only as the dog remains calm. This method helps the dog become accustomed to the presence of others without perceiving it as a threat to its resources. Counter-conditioning. Pair the approach of a human or another dog with positive reinforcement, high-value treats. For example, when a person approaches the dog's food bowl, immediately reward the dog for staying calm. Over time, the dog will learn to associate the presence of others with positive experiences instead of feeling threatened. The Humane Society of the United States, HSUS, recommends gradual and consistent use of these methods to ensure that the dog learns new behaviors while maintaining a calm demeanor around resources. It's crucial to avoid punitive methods, as they can escalate aggression. What are the common causes of inappropriate elimination in cats, and how can a structured approach resolve the issue? Answer. Inappropriate elimination in cats, such as urinating or defecating outside the litter box, can stem from various causes, including medical issues, stress, and litter box aversion. Medical causes: urinary tract infections, UTIs, bladder stones, or kidney disease can cause cats to urinate outside the litter box. A veterinary exam is necessary to rule out these conditions. Stressors. Environmental stressors such as moving to a new home, the introduction of new pets, or changes in the household can trigger inappropriate elimination. Litter box issues. Cats may avoid the litter box due to poor placement, dirty litter, or unsuitable types of litter. A structured approach includes veterinary care to address any underlying medical issues, environmental management by reducing stressors and providing a quiet, safe space for the cat, proper litter box placement, ensuring multiple boxes are available in multi-cat households, and keeping them clean. Describe how you would develop a tailored behavior plan for a dog with leash reactivity. Include the role of antecedent control. Answer. Leash reactivity in dogs where they display aggressive or excited behavior when they encounter triggers like other dogs or pedestrians can be addressed using antecedent control, desensitization, and counter-conditioning. Antecedent control. The first step is to modify the dog's environment to prevent exposure to triggers, such as walking in quieter areas or using barriers like fences. By reducing the frequency of encounters with triggers, the dog's arousal level can be controlled. Desensitization. Gradually expose the dog to low-intensity versions of the trigger, e.g., a distant dog or person, and increase the intensity only when the dog shows no signs of reactivity. This low exposure helps the dog become desensitized over time. Counter-conditioning. During exposure, reward the dog for calm behavior with treats or praise. This helps the dog associate the presence of triggers with positive experiences instead of fear or aggression. The American Veterinary Society of Animal Behavior (AVSAB) recommends this gradual, positive approach to managing leash reactivity, ensuring that reinforcement happens for calm behavior, not for reactivity. Why is interdisciplinary collaboration essential in complex animal behavior cases, and how should communication between professionals be handled? Answer. In complex animal behavior cases, interdisciplinary collaboration is essential to address all aspects of the animal's health and well-being. By integrating the expertise of various professionals, such as veterinarians, trainers, and behaviorists, a holistic treatment plan can be developed. Veterinarians address any medical issues that could be contributing to the behavioral problem. Trainers implement behavior modification techniques. Behaviorists provide guidance on formulating a comprehensive plan and monitoring progress. Communication between professionals should be clear, concise, and respectful. It's essential to share all relevant information, including the animal's medical history, behavioral history, and any previous interventions. Professionals should use shared terminology to avoid confusion and ensure consistent treatment goals. Regular meetings and updates help maintain alignment between all involved parties. Explain how vertical space impacts stress reduction in cats and how this applies to multi-cat households. Answer. Vertical space is crucial for cats as it allows them to control their environment, escape from perceived threats, and find peace. Cats instinctively prefer to perch on high surfaces to survey their surroundings, which gives them a sense of security and reduces stress. In multi-cat households, this is especially important as vertical spaces can provide territorial boundaries that reduce conflict between cats. Providing climbing structures like shelves, trees, or high perches can give each cat a space of its own, reducing the likelihood of aggression and competition for territory. This allows cats to engage in natural behaviors like climbing, scratching, and observing their environment from a safe height. The International Cat Care emphasizes creating multi-level environments in multi-cat households to ensure each cat has access to vertical spaces and safe retreats. This approach can significantly lower stress and promote better harmony within the household. Discuss how positive reinforcement techniques can be applied to manage canine separation anxiety. Answer: positive reinforcement techniques are essential in treating canine separation anxiety as they encourage calm behaviors instead of anxiety-driven reactions. The process involves rewarding the dog for staying calm during periods of separation, desensitization. Gradually increasing the duration of separations while rewarding calm behavior can help the dog adjust to being alone. Start with short intervals and progressively increase the time. Counter-conditioning: the dog should learn that being alone results in positive experiences, such as receiving treats or playing with a favorite toy upon return. This association helps reduce anxiety. A VSAB guidelines suggest combining positive reinforcement with environmental management, such as providing safe spaces and toys to distract the dog. Consistency and patience are key in creating long-term behavior change. How can counter-conditioning and desensitization techniques be used to address a dog displaying aggressive behavior towards strangers? Answer: aggressive behavior towards strangers can be modified using counter-conditioning and desensitization to change the dog's emotional response. Desensitization: gradually expose the dog to strangers at a distance that does not provoke aggression. Slowly decrease the distance over time as the dog becomes more comfortable. Counter-conditioning: pair the presence of strangers with positive rewards, such as treats or praise, to create positive associations with strangers. The dog learns that strangers are not threats. Using a VSAB guidelines, this approach helps change the dog's response to strangers and reduce aggressive behavior over time. Consistency and gradual progression are crucial to success. What is the role of SSRIs in the treatment of animal behavioral disorders, and what are the potential side effects? Answer: selective serotonin reuptake inhibitors (SRIs) are commonly prescribed to manage anxiety-related behaviors, compulsive disorders, and certain phobias in animals. SSRIs function by increasing the availability of serotonin in the brain, which helps regulate mood and anxiety. They are particularly useful for conditions like separation anxiety, generalized anxiety, and obsessive-compulsive behaviors in pets. SSRIs are often used in conjunction with behavior modification techniques to improve the effectiveness of treatment. The medication helps stabilize the animal's emotional state, making them more receptive to training. However, they are not a cure on their own and should not replace behavioral interventions. Potential side effects of SRIs include changes in appetite, sedation, gastrointestinal upset, and in rare cases, aggression or restlessness. It's essential for behavior consultants to monitor the animal closely for any adverse effects and adjust the dosage or medication as needed. The AVSAB recommends using medications as part of a comprehensive treatment plan and emphasizes that behavior modification should remain the primary method for addressing behavior issues. How can the timing of reinforcement impact the effectiveness of behavior modification, and what are the best practices for timing? Answer: the timing of reinforcement is critical in shaping and maintaining desired behaviors. Reinforcement should occur immediately after the target behavior to ensure that the animal associates the reward with the correct action. Delayed reinforcement can confuse the animal, making it harder for them to understand which specific behavior is being rewarded. There are two key types of reinforcement timing: immediate reinforcement. This occurs within seconds of the behavior and is the most effective for new behaviors or complex tasks. It helps the animal quickly form associations between the behavior and the reward. Delayed reinforcement. This is used for maintaining learned behaviors. The delay can range from a few seconds to a few minutes, depending on the complexity of the behavior. However, excessive delay can reduce the effectiveness of reinforcement. Best practices include using consistent reinforcement schedules, e.g., fixed ratio or variable ratio, and pairing verbal praise or signals with tangible rewards like treats or toys. How do animals communicate, and what role does this communication play in behavioral development? Answer: animals communicate through various methods, including vocalizations, body language, scent marking, and facial expressions. Each of these forms of communication serves specific functions such as mating, territory defense, and warning of danger. For example, dogs use barking to communicate with humans and other animals, signaling excitement, fear, or the presence of a threat. Cats use body language like tail flicking or purring to express contentment, irritation, or stress. In social species like primates, vocalizations and gestures play critical roles in social organization, group cohesion, and individual identification. Communication is central to behavioral development because it influences how animals interact with each other and their environment. For example, young animals often learn behaviors by observing and interpreting the communication signals of older animals, facilitating socialization and the transfer of important survival skills. In training domestic animals, understanding their communication methods helps tailor the approach to their needs. For example, learning a dog's body language like tail position or ear orientation helps trainers adjust their behavior to avoid causing stress or anxiety during training. What role does genetics play in shaping the behavior of animals, and how can this influence animal training? Answer: genetics significantly influences behavior, determining temperament, learning ability, and instincts. For example, border collies are genetically predisposed to herd and display high levels of energy and intelligence, making them highly trainable in tasks related to herding. In contrast, breeds like Chow Chows may have more independent temperaments, which can make training more challenging. Genetic influences on behavior can also affect an animal's susceptibility to stress, fear, or aggression. For example, certain breeds of dogs may be more prone to separation anxiety or territorial aggression, while others may have calmer dispositions. Understanding an animal's genetic predispositions can guide training methods. For example, more independent or stubborn animals may require greater patience and consistency, while highly intelligent breeds may thrive on mental stimulation and complex tasks. Additionally, certain genetic traits may mean that stress management techniques are necessary to avoid behavioral issues. Sarah, an experienced dog trainer, is working with a rescue dog named Max who exhibits aggressive behavior towards strangers. Max was found abandoned and had little socialization with people before being rescued. Despite Sarah's efforts to socialize Max, he remains fearful and reacts aggressively when someone new enters the room. How should Sarah approach this issue to modify Max's behavior? Answer: Sarah should adopt a gradual and systematic approach to help Max overcome his fear aggression. Given that Max's behavior is rooted in fear, the first step should be to reduce his anxiety by creating a safe and controlled environment. Sarah should avoid forcing interactions with strangers, as this could exacerbate his fear and aggression. Instead, Sarah can use desensitization and counter-conditioning techniques. Desensitization involves gradually exposing Max to the presence of strangers from a distance that does not trigger his aggressive response. Over time, Sarah can reduce the distance while rewarding calm behavior with positive reinforcement, such as treats or praise. Counter-conditioning can be used to associate the presence of strangers with positive experiences. For example, Max can receive treats or playtime whenever a stranger is present, helping him learn that the presence of new people is not threatening. In severe cases, Sarah may consider working with a veterinary behaviorist who can assess the need for medication to help manage Max's anxiety. How does early trauma, such as abuse or neglect, affect an animal's behavior later in life, and what strategies can be used to address trauma-induced behavioral problems? Answer: early trauma, such as abuse or neglect, can have long-lasting effects on an animal's behavior. Animals that experience trauma during the critical periods of development may develop chronic anxiety, fear-based behaviors, aggression, or post-traumatic stress disorder (PTSD). These animals often exhibit signs of hypervigilance, avoidance behaviors, or difficulty trusting humans and other animals. The effects of early trauma are mediated by changes in the brain, particularly in areas like the amygdala and prefrontal cortex, which are responsible for processing emotions and regulating responses to stress. These changes can make the animal more prone to fear and aggression, even in non-threatening situations. To address trauma-induced behaviors, a combination of therapeutic techniques is recommended. These include counter-conditioning, desensitization, and providing a safe, predictable environment. Gradual exposure to stressors in a controlled manner, along with the use of positive reinforcement, can help the animal overcome its fear responses. In severe cases, medications may be necessary to manage anxiety or hyperarousal. What are the primary ethical considerations when using aversive techniques in animal behavior modification, and how do they conflict with humane practices? Answer: aversive techniques, such as using punishment or discomfort to modify behavior, can raise significant ethical concerns in animal behavior modification. These methods are often controversial because they can cause stress, fear, or anxiety in the animal, potentially leading to unintended consequences, including worsened behavior or damaged trust between the animal and its handler. YAVSAM's best practices and other ethical guidelines emphasize the importance of using positive reinforcement, which encourages desirable behaviors without causing harm or distress. The ethical dilemma arises when the client insists on using aversive techniques because of perceived immediate results, but these approaches can conflict with the animal's well-being. Consultants must weigh the long-term welfare of the animal, adhering to humane practices that prioritize safety, respect, and positive outcomes. Humane behavior modification focuses on understanding the root causes of behavior issues and using less harmful, scientifically backed methods like reinforcement management strategies and enrichment. Consultants must educate clients about the negative effects of aversive techniques, including the potential for behavioral fallout and emotional damage. What are some common signs of anxiety in dogs, and how can they be addressed through behavioral modification? Answer: chewing, whining, panting, and restlessness. Dogs may also exhibit avoidance behaviors such as hiding or refusing to engage with family members or guests. These signs are often associated with separation anxiety, fear of loud noises like thunderstorms, or generalized anxiety. Behavioral modification strategies, desensitization, and counter-conditioning. Gradually exposing the dog to anxiety-inducing stimuli like being left alone while associating the experience with positive rewards such as treats or playtime can help reduce anxiety. Create a safe space. Provide a designated, quiet space for the dog with comfortable bedding, toys, and calming pheromones, exercise, and mental stimulation. Regular physical and mental exercise helps relieve stress and prevents boredom, which can contribute to anxiety. Consulting a veterinarian. In some cases, medication prescribed by a veterinarian can assist in managing anxiety, especially in severe cases. How do rabbits communicate with each other, and what can owners do to promote positive socialization in multi-rabbit households? Answer: rabbits communicate through a combination of body language, vocalizations, and scent marking. Some key forms of communication include body language. Rabbits may communicate their emotions through their posture. For example, a stiff, upright posture can indicate alertness or defensiveness, while flopping onto their side is a sign of relaxation. Thumping. Rabbits use their strong hind legs to thump on the ground as a warning of potential danger or to communicate unease. This behavior is often seen in wild rabbits to alert others of a predator's presence. Nuzzling and grooming. In social interactions, rabbits may nuzzle or groom each other as a sign of affection and social bonding. Scent marking. Rabbits have scent glands under their chin that they use to mark territory. They may also mark items they want to claim as their own. Promoting positive socialization in multi-rabbit households. Gradual introductions. When introducing new rabbits to each other, it is important to do so gradually in neutral spaces to prevent territorial disputes. Providing enough space. Rabbits need adequate space to avoid competition and reduce territorial aggression. Reinforcing positive behavior. Rewarding cooperative and calm interactions with treats can help reinforce positive social behavior. Guideline. The House Rabbit Society recommends supervised interactions and gradual introductions to prevent conflict and encourage positive socialization in multi-rabbit households. How does the use of ethograms improve the accuracy and objectivity of behavioral assessments? Answer: ethograms are detailed records of observed behaviors which allow for systematic and objective analysis of an animal's actions. By breaking down complex behaviors into measurable, observable units, ethograms help eliminate subjective bias, leading to more accurate and reliable assessments. For example, a consultant might use an ethogram to track specific behaviors such as tail wagging, body posture, or vocalizations, assigning each behavior a score based on frequency, intensity, or duration. This approach provides a comprehensive and objective baseline for understanding an animal's behavioral repertoire. It allows consultants to track changes over time, making it easier to identify patterns and assess the effectiveness of behavior modification techniques. Ethograms can also be used to document specific responses to environmental changes, helping consultants adjust their strategies accordingly. Furthermore, the use of ethograms aligns with ethical guidelines that emphasize transparency and scientific rigor in behavior analysis. By using standardized scoring systems, consultants can provide clients with clear evidence-based recommendations that are grounded in observable data.